Florence Nightingale was a pioneering nurse who lived in the 19th century. Born in Florence, Italy in 1820, she grew up in a wealthy British family and was well educated. Despite her privileged background, Nightingale felt a calling to help those in need, and she chose nursing as her profession. In 1853, the British government asked Nightingale to lead a team of nurses to care for British soldiers in the Crimean War. She and her team arrived in the war-torn region in 1854 and quickly set about improving the unsanitary and inhumane conditions in the military hospitals. Nightingale and her team worked tirelessly to care for the soldiers, using their knowledge of hygiene to prevent the spread of disease. She also worked to improve the hospitals themselves, implementing reforms that led to a significant reduction in the mortality rate among the soldiers. Her work in the Crimean War made Nightingale famous, and she became known as the Lady with the Lamp for her habit of making rounds at night with a lamp in hand. She used her newfound fame to advocate for better healthcare and hygiene, both in military hospitals and in civilian life. After the war, Nightingale returned to England, where she continued to advocate for healthcare reform. She also founded the first secular nursing school, the Nightingale Training School at St. Thomas' Hospital, in 1860. This school trained nurses to provide care to patients in a professional and compassionate manner, and it was an important step in the development of modern nursing. In addition to her work in nursing, Nightingale was also a writer and a statistician. She wrote several books on the subjects of health and healthcare, including Notes on Nursing, which is still widely read and used today. She was also an advocate for social reform, and her writings on the importance of clean water, proper waste disposal, and improved living conditions helped to improve public health and pave the way for reforms that continue to benefit people to this day. Nightingale's legacy lives on today, and she remains an inspiration to nurses and healthcare workers all over the world. Her tireless efforts to improve patient care and her unwavering commitment to her patients serve as a reminder of the importance of compassion and dedication in the field of healthcare. She is widely recognized as one of the most important figures in the history of nursing, and her contributions to the field have had a lasting impact on patient care and the development of modern healthcare.